Here's something about women's healthcare that doesn't get talked about enough. Your OB-GYN shouldn't only be the person you see when something is wrong. They can be part of some of the biggest transitions in your life. Your first gynecological visits, contraception and reproductive planning, pregnancy, postpartum care, menopause, or simply keeping track of your health as things change. And because those conversations can be deeply personal, finding a provider you feel comfortable talking to matters. Welcome to Review Remedy by ScoreDoc, where we take healthcare research and turn it into practical information you can actually use. Today, we're heading to Suwanee, Georgia, to explore 5 best obstetrics and gynecology clinics in and around Suwanee in 2026. We're not just going to read the names on the list. We'll talk about what to consider when choosing an OB-GYN, what questions are worth asking, and how to find a practice that fits your stage of life.
And let's start with something important. Obstetrics and gynecology cover a lot of ground. Obstetrics generally focuses on pregnancy and childbirth, while gynecology covers reproductive and women's health outside of pregnancy. But many practices provide both. That means the right clinic for you may depend heavily on what you need right now. Someone planning a pregnancy may prioritize prenatal and delivery care. Someone experiencing irregular periods may be looking for a gynecologist who can investigate the cause. And someone approaching menopause may have completely different questions. So don't just ask, is this a good OB-GYN? Ask, is this the right OB-GYN for what I need?
Let's begin with Blossom Women's Health Center. This is one of the practices featured on ScoreDoc's 2026 list for the Suwanee area. When evaluating a women's health practice, one useful question is, how comprehensive is the care I can receive here? If you're looking for routine gynecological care, preventive visits, reproductive health services, or pregnancy-related care, understanding the scope of the practice can help you determine whether it's a good long-term fit. And here's a practical tip. Before scheduling, write down the top 3 reasons you're looking for care. It could be an annual exam, a specific symptom, or pregnancy planning. Having those priorities ready can make the first conversation much more productive.
Next is Georgia Obstetrics and Gynecology. For patients researching OB-GYN care around Suwanee, this is another provider on today's list. When choosing an OB-GYN, don't overlook continuity of care. If you're planning a pregnancy, for example, you may want to understand how prenatal appointments are handled, who provides care during pregnancy, and what happens when you go into labor. If you're not pregnant, you may care more about being able to see the same provider consistently and having your health history available across future visits. Ask how the practice handles these transitions before you need to know.
Our third featured practice is Miklos and Moore. As you're comparing practices, here's a question that can tell you quite a bit about your potential patient experience. What happens if I have a concern between appointments? For example, if you're experiencing a new symptom or have a question after a procedure, who should you contact? Is there a nurse line? A patient portal? An after-hours number? Knowing the communication process can make a big difference, particularly when you're dealing with something personal or time-sensitive.
Number 4 is North Atlanta Women's Care. For women looking for ongoing care in the Suwanee and greater North Atlanta area, this is another practice worth researching. And this is where convenience becomes more important than people sometimes realize. Think about how frequently you expect to visit. Routine gynecological care may mean an occasional appointment. Pregnancy can mean significantly more frequent visits. So consider location, appointment availability, parking, office hours, and how easy it is to reach the practice. A provider can be excellent, but if getting to every appointment is consistently difficult, that can become a real obstacle to maintaining care.
Our 5th featured practice is Obstetrics and Gynecology, OB-GYN, of Atlanta. When evaluating an OB-GYN practice, it's worth asking about the specific services relevant to your situation. Are you looking for routine preventive care, contraception counseling, pregnancy and prenatal care, menopause management, evaluation of abnormal bleeding or pelvic pain? The more specific you can be about what you're looking for, the easier it becomes to compare practices meaningfully.
So you've got 5 practices on your short list. How do you narrow them down? Here's our OB-GYN checklist. Number 1. Find out what care they provide. Make sure the practice handles the specific service or concern you're seeking. Number 2. Ask about insurance. Confirm that your plan is accepted and ask about potential out-of-pocket costs. Number 3. Consider continuity. Will you be able to establish an ongoing relationship with a provider? Number 4. Ask about communication. Know how to contact the office when you have questions outside a scheduled appointment. And number 5. Think beyond today's appointment. If you're planning pregnancy, ask about prenatal and delivery arrangements. If you're approaching menopause, ask about ongoing management. Choose a practice that fits where you're going, not only where you are today.
There's another conversation worth having before your first visit. What are you comfortable discussing? Women's health appointments can involve subjects people may feel embarrassed about. Period changes, sexual health, fertility, urinary symptoms, pelvic pain, pregnancy concerns, or menopause. You don't need to feel embarrassed, and you don't have to minimize symptoms because they seem awkward to talk about. If something has changed, mention it. Your provider can't help investigate a concern they don't know about.
And if you're preparing for your appointment, bring a few basics. Your medication and supplement list, known allergies, relevant medical history, previous surgeries or pregnancies if applicable, and a short list of questions. If you're experiencing symptoms, write down when they started, how frequently they occur, and whether anything makes them better or worse. You don't have to remember everything from memory once you're sitting in the exam room.
One more important point. Don't assume every OB-GYN practice offers exactly the same care. A practice may have different specialists, hospital affiliations, delivery arrangements, appointment structures, and services. So before choosing one, ask the questions that matter specifically to you. Use ScoreDoc's list as your starting point. Then do the next step. Call, compare, and find the practice where you feel heard and where the practical details work for your life.
If you're researching OB-GYN care in Suwanee or the surrounding area, the complete ScoreDoc guide is linked in today's show notes. You can use it to explore today's 5 featured practices and continue your comparison.
Because choosing an OB-GYN isn't just about finding someone who can treat a health concern. It's about finding a healthcare professional you can comfortably talk to through the questions, changes, and milestones that come with women's health. Thank you for joining us for another episode of Review Remedy. Until next time, ask the questions you're hesitant to ask, choose care that fits your life, and remember that feeling comfortable with your healthcare provider matters.